afternoon, or actually good morning, I guess. For the past almost 4 or 5 months now, our office has been monitoring COVID-19 virus and its impacts across the world and working on how we can minimize those impacts here in Prince Edward Island. Across the world, there are now 6.93 million cases of COVID-19 and over 400,000 deaths. And across Canada, there are over 96,000 cases now and over 7,800 deaths. In Canada, the case fatality rate is 8%. And when we look in the United States, huge number of cases. I believe it's close to 1.9 million, and Brazil over 700,000. The good news in Canada over the last 7 days is that the daily case count is 27% lower than the previous 7 days, and that the daily death rate is 42% lower than the previous 7 days. New Brunswick did announce new cases yesterday, a total of 9 new cases, and a total of 26 linked to the outbreak. And it will likely be another week before they are able to determine if there has been a broader transmission linked to the outbreak. In terms of testing, it is always important to remind everyone that if you're experiencing any symptoms related to COVID-19, please call 811 or contact your family doctor or nurse practitioner and be tested. Since the last time we spoke, we have 882 new negative tests in Prince Edward Island. And just a note that testing for asymptomatic people, those without symptoms, is not as sensitive as when you have symptoms and get tested. So it's not as accurate. For some people in Prince Edward Island, we've talked about it here, when they get repeated testing, that increases the sensitivity of the tests together, and it allows certain people, if they are never able to get out of self-isolation, to try to have a chance to be out of self-isolation if they get repeated tests on a regular basis. For most people, testing does not replace the need for self-isolation on return to Prince Edward Island. We've been asked different times about the antibody testing or immunity testing. PEI does have plans to do population-level serological or antibody testing. And really, the objectives of this kind of a serological survey is to gain a better understanding of the immune response to COVID-19 here in Prince Edward Island, and to look at the utility of serological testing for patients. It's looking at how we estimate the prevalence of COVID-19 infection in the population. Is to inform the scale and scope of public health measures necessary to control the spread of infection in future waves. And we anticipate that this rollout will happen in the next few months, and we're working out the details of the scale and scope. We know there is interest certainly in this antibody or immunity testing, and we will keep people up to date. And since Friday, there's been much public discussion after the protests, not just in Prince Edward Island, but across the country and across North America. I want to be clear that public health, we did not approve a large gathering, but we understand the importance of having voices heard, especially on such a topic. I am pleased to see that the organizers encourage those involved to wear masks and to stay 6 feet apart where possible. And many wore gloves and used hand sanitizers. And those experiencing symptoms were asked not to attend. I share concerns with other medical officers of health I know across the country of whether or not we will see an increase in cases of COVID-19 related to protests. But I recognize that with these protests come many questions about if that can happen, why can't we gather in larger numbers? And it raises the question for sure. But I do not think we should backtrack on how far we've come in terms of taking stepped approach to keep people and islanders safe. And when we talk about mass gatherings or planned events, funerals, weddings, graduation, and these are important to so many people. They're important to me. They're important to all of us. There's importance of faith-based gatherings. There's the times to come together in grieving, times to come together in joy. I do anticipate that the number for these mass gatherings will increase, likely by the end of the month or early July. And we are hoping that all goes well until that time. And in the back of it, our goal here, not just in this province, but across the country, it remains to minimize the number of cases, the outbreaks, and the impact on our healthcare system. And we do not want to feel overwhelmed by an outbreak. And the mass gatherings, if we have a case, could lead to, in a mass gathering, could lead to so many more. And our ability to follow up, to do contact tracing, and to protect people is certainly challenged the larger number in a mass gathering. And speaking of mass gatherings, graduations, my mother found last week something that had been read at my graduation many years ago, and it said, graduation is not just a piece of paper, but it is a new beginning, a real commencement. And it made me think that of all times, this graduation season seems to be about new beginnings as we take the first steps out of this wave of COVID-19, and it's a new way of doing things and a new way of functioning. So our office has been able to provide guidance for graduation ceremonies to the Department of Education and the Public Schools Branch and the Commission Scolaire Langue Française. And schools were asked to submit plans really to the Public Schools Branch and department to come up with options to have graduation within that guidance. And it's wonderful to see such various innovative, creative options coming out of island schools, each fitting within that guidance. We know UPI and Holland College did not have any in-person graduation ceremonies, and we have some provinces who are going totally virtual graduations. But PEI schools are finding different ways to celebrate this important milestone. Of course, we continue to get questions and requests about islanders leaving the province for non-essential things, shopping, picking up a pet. And when you're considering this, you should determine whether the travel is necessary at this time. And as an essential worker, if you leave the province for purposes unrelated to your work, you are not exempt from self-isolation. If you decide to travel for non-essential purposes, you do need to self-isolate upon your return. You may also be required to self-isolate at your destination. And Marion may speak about this as well. Visits at long-term care facilities across the province is now underway. And I know it's hard to visit outdoors and still remain 6 feet apart, and it won't always be this way. When you look across the country, we are certainly one of the earlier places to reopen long-term care visitation. So we're doing so cautiously and carefully. Seniors in long-term care facilities are at high risk of complications and death from COVID-19, and that risk still exists here in PEI. And we would really like to protect that vulnerable population as we navigate this pandemic and prepare for any potential second wave of the virus. And many islanders, and we've talked about this before too, are wearing non-medical masks, and whether that's for work, for appointments, or when they are in other areas where maintaining physical distancing is difficult. Cloth face masks are not for everyone. Children under age 2 or anyone who has trouble breathing or is unable to remove the mask without assistance should not wear one. Although it may seem simple, it is very important to wear a cloth mask correctly to protect others around you. Wash hands before putting on your mask. Put it over your nose and mouth and secure it under your chin. Try to fit it as snugly against the sides of your face, but make sure you can breathe easily. Don't put the covering around your neck or up on your forehead. It should cover both your nose and mouth comfortably. And don't touch your face mask while wearing it, and if you do, be sure to wash your hands. And when you remove your mask, undo the straps or strings, handle only by those, fold the outside corners together, and wash before using again. As I've said before, it's important we don't become complacent. The risk of COVID-19 has not disappeared, and the pandemic is not over. Although I know we're all wishful that it will go away quickly. Prince Edward Island, you, me, our families, our communities, our government have worked extremely hard to get where we are today. We need to think small numbers, be careful and cautious, but we are taking great steps as we move forward. Aren't we fortunate that we are having these conversations at this point about how soon, how many people, and we are not focused on how many people are in hospital or how many people may have died. So let's together look out for one another. Let's be patient. Let's be kind. Thank you very much.
Good morning, everyone. As we previously noted here, Health PEI is working to reinstate services under the guidance of the Services Reinstatement Team that has been put in place. This team has approved many plans for easing back services across the health sector, and many of these services will be providing updates on the ease back in their area in the coming weeks. I'll talk about a couple of them today. Additional Health PEI services have been reintroduced, and some of those already opened have increased volumes. One example of that is with respect to surgeries. In the month of May, we did just over 500 surgeries, and last week alone, 424 surgeries were completed. As more services are reinstated and more surgeries and procedures are completed, we'll be sharing that information here and putting some information online on the Health PEI website. As we continue to reinstate services in Phase 3 of the Renew PEI plan, I'm happy to share some changes happening in mental health and addictions as well. Islanders now once again have access to community mental health and addictions walk-in clinic services. All mental health and addictions walk-in clinics across PEI were temporarily converted to call-in services due to the COVID-19 response and public health measures. Walk-in services have now resumed using appropriate physical distancing guidelines. For those who are more comfortable calling in and to assist with our physical distancing measures, call-in services are also still continuing. Mental health walk-in and call-in clinics offer immediate mental health support to clients who are struggling with anxiety and events that cause stress or other mental health and addiction issues. These clinics provide immediate support for Islanders seeking assistance with substance abuse or gambling, and appointments or referrals are not required for these call-in or walk-in clinics. Sessions usually take 45 to 60 minutes, and there is no cost for these mental health and addiction services. We're recommending but not requiring that individuals call ahead to assist staff with planning for appropriate physical distancing. Islanders can also access other mental health and addiction services via the 1833 information line, the psychiatric urgent care clinics, the child and youth urgent care, mental health care call-in line, and many more. Any door is the right door to get started if you need help. For more information on mental health and addiction services, please visit the Health PEI website. Just a reminder that all our appropriate precautions are in place to ensure our hospitals and health centers and clinics are safe, and attending your appointments and getting your procedure is important to your health. Be assured that you are in a safe place for care. If you have concerns, discuss those with your healthcare provider. Thank you.
Thank you, Marion. And we'll open it up for any questions.
Brian Higgins, CBC.
Yes, good afternoon. Good morning, Dr. Morrison. When it comes to the subject of mass gatherings, you mentioned that later this month or early July, depending on how things go, we might see the numbers increase. Could you be more specific about the numbers and what needs to happen to allow those numbers to increase?
Hi, Brian. So really, we're talking about moving into the next phase of from our Renew PI plan together. And it would, I anticipate that number would go up to 50. And that will be for all kinds of mass gatherings, but that would be maintaining physical distancing and hand hygiene, all the other things we've talked about. And you've seen some of our personal gathering numbers have increased over that period of time, over the last number of weeks, and you've seen that happen across the country. And mass gatherings are different than really personal gatherings. They're planned events. They're, we've talked about funerals, we've talked about weddings, graduations, faith gatherings, sports environments as well. And so that's, I don't have a date yet, but I would anticipate that would be later June or early July. And as soon as we have a date, we'll let you know.
Thank you. And if I can ask one more question, can you tell us more about that antibody study, what its goals would be? I think a lot of people don't know much about that area of science.
Yes, Brian, we have had questions about that before because, as you know, there have been a couple of antibody tests or immunity tests that have been approved for use in this country in the last month. And I think the whole country, the whole world is really wanting to learn more about immunity, serological tests, and not only what if it'll show immunity, but how effective that immunity is. So even if the blood test shows that you've had exposure to COVID-19, does that mean it offers the same level of protection? And so there's certainly a lot to learn, not just in PI, but we'll contribute to that as we go forward. It'll be a longitudinal approach where there would be sampling done over a period of time over the next year. And really, in terms of the goals, I think I talked about a couple of them. It will help us understand the immune response, how prevalent COVID-19 has been in Prince Edward Island. So even though we've only had a certain number of confirmed cases, we've had people say, well, what if I had exposure and maybe was asymptomatic or had such mild symptoms and I didn't get tested? I think that number will be small, but it's important to find out. I think it also contributes to our knowledge about vaccines and how we can sort of the immunization strategies as we go forward as well. So it'll be more as a study going forward. And I think it's really exciting that we will be able to participate in this type of immunity testing and learn from it.
Thank you.
Louise Martin, CBC.
Oh, hi, and good afternoon to you both. Dr. Morrison, I was just wondering, yesterday we heard that Canada will begin to allow some family members separated by the travel restrictions to cross the border from the U.S. into Canada. So I'm wondering, I know you've spoken about the reunification of family members, where we are on that as far as bringing them to Prince Edward Island. And does that announcement yesterday mean that family members in the United States will be able to come to Prince Edward Island, I guess, under self-isolation measures and things like that?
Hi, Louise. So yes, we've spoken about certain family is the need for families and to reconnect with our island residents, and recognizing how important that has been and how that support, people have missed that over the last number of months. And we have, for instance, grandparents who have not been able to see new grandchildren. We have children who want to get home and see elderly relatives here. And so we are, and that would involve self-isolation, and I think we need to be clear. Just as international family reunification that the federal government spoke about, that would mean that people do have to self-isolate here on arrival for 14 days. That same principle would apply at this point in time for family coming from somewhere else in the country. And we are working on a process of what that would look like. I think the definition of family that the federal government is using, we need to look at our definition of family and see if we need to make adjustments on that definition. And I think the federal reunification program is clear that there were spouses that were separated. For instance, if one spouse was a non-Canadian citizen, and so it was difficult for them to return to be here with them. The numbers that will be involved for Prince Edward Island, it's difficult to know, but they will, from an international reunification family process, also have to self-isolate. So I don't have too many more details at this point in time, but we are working on a process and recognizing that it's important. We know people are anxious to hear about that. It is not going to be for everyone to just come and visit because they want to have a vacation here. It is. It's in keeping with some of the same principles of reuniting families and connecting them where there is a recognition that that's really important for all of us.
Thank you. So just to clarify, there's no timeline on that right now then?
No, but knowing that we're actively discussing it, spoke about it with our team this morning, and we're hoping to have a timeline on it sooner than later.
Great. Thank you so much. My second question, just quickly, is looking to confirm whether, to your knowledge, any businesses on PEI have been found to be in violation of restrictions or without proper operational plans or not following those plans?
Not to my knowledge, but I don't have that I haven't been told about any at this point in time, but I was advised that by the end of next week, we'll have a report on how many businesses have been inspected and sort of on what they've found. So I did get that input this morning.
Okay, so we can nag you about that later. Thank you very much.
So yeah, okay.
Jim Day, The Guardian.
Good morning to you both. Dr. Morrison, you spoke to the Black Lives Matter march held in Charlottetown Friday. It was a very important event and well run, but there still was an estimated 2,500 to 3,500 people that gathered. Many were not wearing masks, and social distancing was not maintained in numerous instances over a fair period of time. I wonder if you can quantify just, what your level of concern is that gathering may result in community spread, and if it does, what action will be required?
Hi, Jim. So I think, as you said, a very important issue that is being raised here and across the country, and it highlights the right to protest, but how we have to be so careful in times of COVID. So I think my level of concern is, and I have said this here before too, I feel like I'm always worried about the spread of illness, and because I don't want people to be sick, and I don't want to see people end up in hospital and unintentionally impact others. So I think it was outside. I know a lot of people were wearing masks. I hope they did not go if they were immunocompromised or ill. I think we'll know more in the next 2 weeks, and I think that's what we're hearing right across the country. We'll see what happens in the next 2 weeks. I encourage anyone who may have participated, certainly if they get sick, they should be tested. And if we find anyone who has COVID-19 who was involved in the protest, then of course there will be notification, and the contact tracing will have to look different than it would if we knew exactly how many people and who they were in a different setting.
Right. Not to be too gloomy, but would it have the potential to push back the third phase?
Yes, if there was a large outbreak, yes.
Okay. Thank you very much.
Julien Lecacheur, Radio-Canada. Julien Lecacheur, Radio-Canada.
Bonjour, Dr. Morrison. Dr. Morrison, question pour vous. Depuis la semaine dernière, le Nouveau-Brunswick autorise les touristes québécois à traverser le Nouveau-Brunswick. J'aimerais savoir, vous, de votre côté, on en est où à l'île du Prince-Édouard? Est-ce que les touristes québécois peuvent se rendre au traversier de Souris et donc se rendre aux îles de la Madeleine?
Bonjour, Julien. Alors, ce que je comprends maintenant est que les touristes du Québec qui vont aux îles de la Madeleine ont comme une lettre qui disent qu'ils voyagent là-bas. Et puis alors, ça va marcher un peu comme ça marche maintenant. Ils vont montrer la lettre. On demande qu'ils montrent aussi quelque chose qui montre la réservation qu'on a au traversier pour les îles de la Madeleine. Alors, et puis ils sont dirigés d'aller directement du pont au traversier. Alors, c'est qu'on fait maintenant. Alors, j'imagine que ça va continuer comme ça. La seule chose qu'on parle de plus en plus qu'on a besoin qu'ils montrent la réservation qui indique qu'ils vont vraiment aller sur le traversier.
Deuxième question pour vous, Dr Morrison. Pouvez-vous me donner le nombre exact d'applications que vous avez reçues depuis le 1er juin concernant les résidences secondaires? Et est-ce que vous avez déjà accepté des demandes et donc des touristes des propriétaires de résidences secondaires arriveront à l'île du Prince-Édouard dès la semaine prochaine?
Alors, Julien, les applications ne vont pas à mon bureau, ils vont au bureau du Sécurité, Office of Public Safety. Il y a quelques jours, depuis que j'ai entendu le nombre qu'ils ont reçu, mais je pense qu'ils ont reçu 360 à peu près de la région atlantique. Et le dernier nombre que j'ai entendu, que c'était 1300 à peu près en tout. Alors, ils sont dans commence le processus de donner les lettres pour ces gens dans l'ordre qu'on a déjà discuté.
Merci beaucoup.
I may just translate that into English so that others can hear. I was asked about the exact number of seasonal applications to Prince Edward Island. Of course, those applications don't go to my office. They go to the Office of Public Safety. And the last I heard, it was a couple of days ago, was that they had processed 363 applications from the Atlantic Canada area, and that they may have received a total of around 1,300 applications, and that was a couple of days ago. And so they are working through that process, and that is through, of course, Justice and Public Safety, and that office is looking after that. So that was one part of it. And also a question around people going to the Magdalen Islands, and we've certainly had that question come up before as well. But anyone who would be traveling cross through New Brunswick and then through PEI to the Magdalen Islands, my understanding is that they do have a letter of approval from the province of Quebec that they present at the bridge, but also we've asking for proof of their reservation on the ferry for the Magdalen Islands, and then they were advised and directed to go straight to the ferry. So those were the two questions in French.
Laurent Rigaud, La Voix Acadienne.
Good morning to you both. J'ai une question pour vous en français, Dr Morrison. J'aimerais savoir si le processus de demande d'accès qui est mis en place pour les résidents saisonniers, est-ce que tous les autres voyageurs qui veulent venir à l'île du Prince-Édouard, par exemple qui sont des résidents permanents et qui veulent revenir chez eux, est-ce qu'ils doivent aussi passer par ce processus préalable?
Bonjour Laurent. S'ils sont résidents de l'île du Prince-Édouard, il faut seulement présenter votre comme permis de conduire. Ils sont indiqués que vous êtes un résident permanent ici à l'île du Prince-Édouard. Alors, il ne faut pas faire un processus d'application comme les résidents saisonniers.
D'accord. Et juste un follow-up sur ça. Au-delà des résidents permanents, d'autres personnes qui obtiennent un visa de travail, par exemple, pour venir à l'île, ou des étudiants, ou d'autres personnes qui ne sont pas résidents temporaires ou résidents permanents, est-ce qu'ils doivent passer par ce processus d'examen d'abord?
Alors, il y a un processus pour les résidents saisonniers, mais il y a aussi vraiment un processus pour des autres circonstances comme les étudiants au collège vétérinaire pour l'instant. Alors, ils doivent avoir faire l'application, mais ils ont parce qu'ils n'ont beaucoup de fois, ils n'ont pas un permis de conduire de l'île du Prince-Édouard ou une carte pour la santé ici, leur carte pour montrer. Alors, ils doivent faire une application comme étudiants ou ils ne sont pas résidents permanents.
OK, merci.
François-Pierre Dufault, Radio-Canada.
Good afternoon to you both. Question en français pour vous, Dr. Morrison. Vous l'avez évoqué un peu en anglais au début. La phase 4 pourrait commencer plus tard ce mois-ci ou au début du mois de juillet. Qu'est-ce que ça voudrait dire pour les rassemblements extérieurs qui sont permis ici?
Bonjour. Pour vraiment la prochaine phase, c'est augmenter le nombre de personnes pour les rassemblements et j'imagine que ça va monter jusqu'à 50. Et la date, le fin de juin, le début de juillet, j'imagine. Et alors, c'est un partie de cette phase 4. Et on regarde les autres choses aussi. Est-ce qu'on doit changer la guidance à partir de toutes les choses, même pour les visiteurs au long-term care. Pour l'instant, on va regarder ça aussi. Et je sais que c'est un processus qui est en train d'être fait quand même. Mais c'est plutôt les rassemblements parce que c'est pour les sports, les églises, les mariages. On entend qu'il ne peut pas fonctionner au même niveau si on n'a pas un peu plus de nombre. Et puis, on va voir ce qui arrive dans les 3-4 semaines qui suivent.
Une dernière question, si c'est possible. Vous avez évoqué aussi en anglais l'inquiétude que vous avez eue par rapport à la manifestation qui a eu lieu vendredi. Il y avait beaucoup de gens. Quelles pourraient être les conséquences d'un regroupement aussi grand que celui qu'on a vu la semaine passée?
J'espère qu'on ne va pas avoir les conséquences, mais si on a un cas de COVID-19 et ils étaient là, on doit regarder si ça va être... on va annoncer vraiment parce qu'on ne peut pas avoir les noms, on ne sait pas exactement qui était là. Alors, ça va être plus d'inquiétude parce que ça peut être un peu partout dans la communauté. Alors, j'espère que ce n'est pas le cas, mais on va voir dans les 2 semaines qui suivent. Et j'espère que s'il y a quelqu'un qui était là, s'il devient malade, il faut aller tout de suite pour être faire tester.
Merci beaucoup.
I think that might be it. So thank you very much. Have a good day.